And you're saying as well that you do a lot of work with some of the care facilities around this area as well. I understand you've done quite a bit of work to support the carers as well in the practice. Can you just tell some more about that as well?
Yeah, when I started back in October 2014, one of the areas identified is that we didn't have a huge number of carers identified within the practice. Right. And obviously with a population of 12,000 at the practice, we should in theory have quite a number of carers. So I started to engage with the Cheshire and Warrington Carers Trust, who are a local organisation who support carers, just to look at how we can start to identify and increase the number of carers that we had on our register. And we had quite a long discussion about whether we wanted to just go for pure numbers or whether we wanted to go more along the quality side. And what we decided to do, rather than just hit number of carers, because we could probably quite easily have done that, was actually go down the side of actually let's concentrate on the ones that we do identify and really make those referrals a quality referral. So then we started to look at a bit of a strategy on how we start to change the culture of supporting and identifying the carers within the population. So the first thing we did was some training. Carol from the Carers Trust came in. She did training with the patient services team as well as the clinicians, just so they were aware of the carers, the new Care Act that's come in, the reasons for supporting the carers, the benefit to the patient, the practice and the carer. And it was very much a holistic approach that we wanted to take to make sure it kind of fitted in. And then it was a case of starting to work with the patient populations. We engaged with the PPG, looking at ways that they felt we could start to engage with carers. We had carer links within the patient services team, and also developed that to dementia links as well. So patients could actually speak to a named member of staff if they wanted further support or advice. We then started to look at, I suppose, more innovative ways. So we have a carers drop-in clinic every month, the last Thursday of each month. And that's publicised quite widely in the practice. Right. So Carol from the Carers Trust, she comes in for 2 hours every Thursday afternoon, and patients can just drop in and see her. And we're quite surprised how many carers are utilising that drop-in clinic. So initially we started it in February, and we thought we'll just run it for 3 or 4 months and see if there is a need. And it was quite clear from month one that there was a definite need for that. What we've then started to do is actually offer that service to other practices in our sort of locality, just to let them know that if they've got carers or people that want to know more about the caring trust, they can actually come to our practice on that Thursday as well. So I suppose it's trying to support other practices as well as just ourselves in the initiatives that we're trying. Then the other area we developed is what we call a patient buddy system. Right. Initially it was very much looking at the carer side, but since we started to develop this role, I think the role of the patient buddies expanded as well. So basically 3 mornings a week, a member of the patient services team spends time on the other side of the reception desk, in the waiting room. They'll sit down, they'll talk to patients, they'll ask them, you know, initially it can just be can we just make sure your contact details are correct, as a kind of way of getting into the conversation with the patient. But then they can start, you know, asking if they care for someone, if someone cares for them, if there's ways we can improve the service, access. So what was initially just an idea to possibly identify carers has actually started to identify other improvements that we can make to the practice and sort of offer. It's been really helpful to promote online services, so booking appointments online, but also online access to their medical records. So it just gives the patient services the time to spend with the patient and talking to them, but also from a patient's perspective they feel more valued, because actually from their side they can see the practice investing in that time to actually engage with the team and with the patients.
So it sounds like since you started, you you don't seem to have been standing still for quite long lengths of time. Yeah. There's lots of new and innovative ways of dealing with the demands. I mean, what's next for you and Hope Farm as a practice? What other things are you looking at, or what do you expect coming over the horizon?
I think obviously one of the key things is obviously looking at the new building developments in the area, looking at how that's going to impact on our patient population, looking at ways that we can possibly look at expanding the practice, offering other services. One of the kind of key aims we want to do is start to engage with the third sector and bring in services such as, I don't know, citizens advice, debt advice, and actually have those situated in the practice. We've had a lot of training and sort of work on social prescribing over the last 12 months to help patients with their social needs, so hopefully that will then improve their health, so it should have the knock-on effect that they then don't need to come and see the GPs as much. So again, we want to start developing and increasing that. We also want to obviously link in with the sort of 5-year forward view and utilise practice pharmacists, possibly the practice physician associates as well. Yeah. So there's all these different kind of initiatives out there, but what we need is space to do it, and at the moment we're probably maximum at the current capacity in the current building sites. What we need to do is look at how we can expand and access different areas of funding to enable us to do that, and possibly link in with other practices and networks and trusts in the area.
Right. So you've got quite a holistic approach, I suppose, to the way that you want to deal with patients and respond to what they need as well.
Yeah, again, I went on a site practice visit to Bromley by Bow in London, right. And kind of saw firsthand kind of how the social prescribing side of general practice can really change and empower patients. Yeah. And I think that's what we want to try and do here, is look at the holistic approach, because we could tread water for forever and a day trying to just deal with patients' health needs. Yeah. But if we don't tackle some of their social problems and issues, we're never going to be able to solve their sort of health and clinical needs. So it's very much trying to get that early intervention in to help resolve those social needs. We've got a wellbeing coordinator in the practice. Gemma's been here for just over 12 months now, and what we can do is refer patients directly to Gemma, yeah. And she can give them a sort of a one-to-one support, looking at their sort of social and welfare needs, and refer them on to other services.
So from the things that you've learned and what you've put into practice and the experiences that you've had, what would you say are your top 3 priorities or must-dos for practices?
Networking, I think, is extremely important, and possibly slightly underestimated at times. I certainly spend a lot of time networking with the LMC and the CCG. I want to know the new initiatives that are coming out, any new services that are on offer, because if I know about them, I can then decide if they're relevant for us and whether I want to push for us to either pilot them or be involved with them. Yeah. Even just networking with the other practice managers. So we've got, within our locality, we've got a local practice managers meeting, as well as the sort of wider West Cheshire one. And that was really invaluable for me when I first came into general practice, because obviously I hadn't worked in this sector before, and having that local support I think is really important. So I would say networking is a real key to understand what's happening, what's likely to happen, and those sort of changes on the horizon. I think trying to keep a handle on the finances. Obviously I've come from an accountancy background, so I suppose that's sort of slight advantage for me. But it is complex at times, and there's lots of different funding streams coming in. Payments come into the account that you don't necessarily know what they relate to, so it's having to find out what they are. So it's having a really robust sort of financial process in place, both from a cash flow and a budgeting perspective, so you really know where you are both on a cash perspective and a profit perspective on a month-by-month basis. So you can make those decisions if something suddenly happens to your building or whatever it may be. You need to be able to know that you can react to that.
Right. And obviously you've spent a lot of time with developing your teams as well.
Yeah, I think one of the things I learned when I came in was to really get to know the team, understand how they worked before I implemented any change. It was talking to them, spending time with them. Once you've kind of got an understanding of how they sort of work and some of the improvements we might need, it's a lot easier to then start bringing that change in. I'm very fortunate here that the partners really engage with me and are very supportive of some of the initiatives that I've come up with. So I think that's a real bonus if you've got real partner engagement and they're on board with the same vision and strategy as you are. Yeah. It makes life a lot easier for the practice manager.
You've obviously got a very successful, very busy and very popular practice here as well. And it's a credit to you and the team for all the recognition that you've achieved as well. But what keeps you motivated? More importantly, how do you keep the team motivated as well?
I think one of the key things is the fact that it is a whole team approach, and any recognition that we get, we make sure we share that as a team. When I first started, we did a staff barometer, staff survey, so we were able to sort of engage with the team to see where their sort of support was on certain areas, how motivated they were, areas that we could improve as a management team. Sort of from there, we were able to bring in an award system. So every month, people can nominate a member of the team, first kind of going above and beyond the call of duty. So that's just a way of being able to sort of recognise and say sort of thank you to the team. So I certainly think that engagement is really important and developing them.
Good. And what about yourself? What makes you want to carry on and turn up every morning?
I suppose I like a challenge. I like kind of a fast-paced environment. I don't like things to sort of stand still. The fact that we can provide sort of high-quality, patient-centred care to our patient population is obviously really important to the whole team as well as me. And so I think that's probably one of the most motivating factors for me, is getting the satisfaction back from the patients that the service we're delivering is meeting their needs. They're happy with the service, and they're supportive of any new initiatives or change that we're looking at introducing.
Okay, Tim Goldsbrough, thank you very much.
Thank you.